What is up, guys? Welcome on back to the news with TK, and the hits keep on coming. China trade deal market explodes today, and then the president signs an executive order to have drug companies pharmaceutical companies voluntarily lower their prices, or to bring most favored nation status to their pricing for American consumers, which will save seniors the most, I think. Tons of money by not having to pay, as he said, he had a fat friend, I don't know if we'll have that in that clip, but he had a fat friend, is what he said, that was paying $1,100 for Ozempic here and $88 for it in the UK. Make it make sense. So welcome on back to the news with TK. I saw some interesting takes here, and Mehmet Oz was also on Fox Business and got into detail on what this meant, and another short clip from the White House as well for you, basically discussing and talking about what's happening with these drug prices. I think, with what's going on with Kennedy being at HHS, he's literally pushing to make America healthy again. Seeing him in that role has been huge, at least for me, because I think he's really going to change a lot of things when it comes to food, drugs, and everything else to end a lot of the chronic disease issues that we have here in the United States. But that's a separate video. Let's roll these two clips here back to back talking about the executive order signed by the president today. Roll it.
CMS Administrator Dr. Mehmet Oz. Dr. Oz, thank you for joining us. There are so many questions I have, our viewers have. Americans who have struggled to pay more than the rest of the world for drugs are cheering today, I'm sure. The president's executive order, which pushes pharma to bring those prices down, is voluntary. What is the plan to force them to do it?
Well, the president wants equalization. That's the word that he used. And it's mostly about fairness. So over the next 30 days, we're approaching all the major pharmaceutical companies and saying, this is what your drugs cost in other countries that are similar to ours. We want most favored nation status, which means, again, very specifically, if you're willing to sell, as President Trump's anecdote about a portly friend of his who was getting a GLP drug in London said, I can get it for $88 here. I've got to pay $1,000 in America. That doesn't seem fair. And so most pharmaceutical companies, I believe, and they're going to hear from us over the next few weeks, understand that this is not really right for America to have to generate 70% of their profits, and we're only 4% of the world population. So we believe there's going to be a desire to come to an understanding, and you see from the stock prices on pharmaceutical companies that others may think this is also okay for that sector. My belief is that if we can't get this to the right place in 30 days, there are tactics we can use. They exist already within government. The president has some opportunities. Congress obviously has options, but the best case scenario would be we all get along and say, hey, listen, this is something that you as an American probably don't think is right either. How do we get Europe to pay a little more so America can pay a little less? And that is exactly what I think the pharmaceutical shareholders will be okay with, because they're going to make the same amount of money, just not all of it from the U.S.
Right. So that's why, in a way, people are expecting that the pharmaceutical stocks should be okay. As a business network, we look at that. But as the daughter of a doctor, I mean, my dad used to tell me that he had patients who were breaking their pills in half because they really couldn't afford to pay. And meantime, you had other nations, and I'm not talking about poorer nations. I'm talking about comparatively similar developed nations paying less than Americans were. So that is something I think that resonates with everybody. I was watching you today with the president, and everybody was taking their turn to talk. Something you said really caught my ear, and that was where you said, it's time to take on the withering lobbyist pressure. I can hear them knocking on your door already. Have the pharma lobbyists and the pharmacy benefit manager lobbyists already reached out? What are you saying to them?
I'm saying that as an American, you want to make sure this system is sustainable and is going to last for many, many more years so your businesses continue to thrive. We want innovation. The president spoke to that openly. Secretary Kennedy spoke about the fact that we're proud to be leading the path forward, but it's got to be a financial model that makes sense for us as well. And you spoke about your father, Liz. As a physician, and three of us on that panel that you see there are doctors, our biggest problem is when we tell a patient, because our Hippocratic oath is to help get people healthier. We give them advice and we take care of their health issue, and then they're bankrupt. Let me give you a number on this. It's going to stun you. This is a Kaiser Family Foundation data point. 62% of bankruptcies, two-thirds, are caused by medical issues, health issues, some of them driven because you cannot afford the medications. In fact, 30% of people who are prescribed medications say they can't take those medications as prescribed because they can't afford them. That's not bringing health to Americans. Let the doctors, let the hospitals, let everyone involved provide the best care possible. Let's make it affordable so it's sustainable.
Starting today, the United States will no longer subsidize the health care of foreign countries and will no longer tolerate profiteering and price gouging. For the first time in many years, we'll slash the cost of prescription drugs, and we will bring fairness to America. Drug prices will come down. We're going to cut out the middlemen and facilitate the direct sale of drugs at the most favored nation price directly to the American citizen.
I'm just so grateful to be here today. I never thought that this would happen in my lifetime.
This is the most powerful executive order on pharmacy pricing and healthcare ever in the history of our nation. By getting our allies to pay a bit more, we'll course correct a problem that's gotten out of hand.
We're standing up for the American consumer who's been paying far too high prices for far too long.
So let me know what you guys think in the comment section down below. Is this big news? I think it comes right on the heels. I mean, just think about it. This administration is just nuts, man. Every day there's some other big news item in terms of trade deals, right? Nobody expected a trade deal to get done with China. Nobody expected these tariffs to come as far down as they did. The market has rapidly responded. The futures market for tomorrow is already insane. All of the losses in that time period have been gained back since April 2nd, and now the market is higher. And we're probably going to see some all-time highs probably before the end of this month. So let me know what you guys think in the comment section down below. What do you think about the pharmaceutical executive order signed by the president today? Let's have a discussion in the comments. As always, stay petty, my friends.